pregnancy, would your bill apply if a physician was simply willing to certify that the continuation of the pregnancy would impair the mental health of the woman? How late are we talking about?
Well, so the way the suggestion that we've made in the bill is to say it's in the third trimester and at the, with the certification of the physician. So
how late in the third trimester would you be able to do that?
It's very unfortunate that our physicians, witnesses, were not able to attend today to speak specifically.
No, I'm talking about your bill. How late in the third trimester could a physician perform an abortion if he indicated it would impair the mental health of the woman?
Or physical health.
Okay.
Okay.
I'm talking about the mental health.
So, through the third trimester. The third trimester goes all the way up to 40 weeks.
Okay. But to the end of the third trimester?
Yep. I don't think we have a limit in the bill.
So, where it's obvious that a woman is about to give birth, she has physical signs that she is about to give a birth, would that still be a point at which she could request an abortion if she was so certified? She's dilating.
Mr. Chairman, that would be a decision that the doctor, the physician, and the woman would make.
I understand that. I'm asking
point.
if your bill allows that.
My bill would allow that, yes.
Fairfax County Delegate Kathy Tran made her case for lifting restrictions on third trimester abortions, as well as other restrictions now in place. And she was pressed by a Republican delegate about whether her bill would permit an abortion, even as a woman is essentially dilating, ready to give birth. And she answered that it would permit an abortion at that stage of labor. Do you support her measure and explain her answer?
Yeah, and I wasn't there, Julie, and I certainly can't speak for Delegate Tran, but I would tell you, first thing I would say, this is why decisions such as this should be made by providers, physicians, and the mothers and fathers that are involved. There are, when we talk about third trimester abortions, these are done with the consent of obviously the mother, with the consent of the physicians, more than one physician, by the way. And it's done in cases where there may be severe deformities, there may be a fetus that's non-viable. So in this particular example, if a mother is in labor, I can tell you exactly what would happen. The infant would be delivered. The infant would be kept comfortable. The infant would be resuscitated if that's what the mother and the family desired. And then a discussion would ensue between the physicians and the mother. So I think this was really blown out of proportion.
I'm Kathy Tran, and I represent the 42nd District in the Virginia House of Delegates. I know women in my family, women in my district, and women across Virginia who've had to make the very personal decision as to whether or not they're going to have an abortion. That's why I introduced a bill to repeal the medically unnecessary and unduly burdensome barriers that Virginian women face when they're accessing this health care service in consultation with their doctor. I presented my bill this week, and I was really surprised by the line of questioning that I got. This bill had been introduced in the General Assembly in previous years, and in fact, this session was also introduced in our state Senate. I want to be very clear about what's currently allowed in Virginia law. Right now, women are able to access an abortion in the later stages of pregnancy under certain conditions with the approval of medical doctors. I've done nothing to change that. What I have done is try to make sure that women are able to make these decisions and access these services in a timely manner. Since the bill hearing, I've heard from many women in my district and across Virginia who support my efforts to make sure that politicians don't get between a woman and her health care decisions. I appreciate their support, and I will continue to stand with the women in Virginia.